Councillor Croson, can you hear us?
Hi, I can. Thank you.
Perfect. Thank you.
Quick sound check there. Councillor Croson, can you hear us okay?
Absolutely.
Yeah, thank you very much. We're going to be starting here in a moment.
Perfect. I like meetings that start on time. Hello, Jeff.
All right, welcome everybody to the Cultural and Social Standing Policy Committee for April the 27th. Welcome everyone here. First off, Mr. Clerk, well, let's start with a roll call, please.
Certainly. Thank you, Mr. Chair. Councillor Carlson.
Present.
Councillor Palladino.
Present.
Deputy Mayor Schmidt-Rempel.
Here.
And Chair Campbell.
Present.
Excellent. And then also online we have Councillor Croson and the City Manager Brierley is online. Several members of the executive leadership team here as well.
Thank you. We'll start with the acknowledgement statement. The City of Lethbridge acknowledges that we are gathered on the lands of the Blackfoot people of the Canadian Plains and pays respect to the Blackfoot people, past, present, and future, while recognizing and respecting their cultural heritage, beliefs, and relationships to the land. The City of Lethbridge is also home to the Métis Nation of Alberta, Region 3. We will have the adoption of the agenda. Mr. Clerk, is there anything that we need to add to this?
We received a letter this morning in relation to item 6.3, the Legacy Park pickleball courts. It is not currently in your agenda. If committee wishes, you could amend your agenda to include it, and we'll need about a 5 to 8 minute recess just to republish.
I will ask committee members if they want that letter included in the agenda. All in favor? Jeff, are you a yes?
Yep, in
Okay.
favor. Sorry.
And we will include that, so we'll need 5 minutes.
Excellent. Just give us a 5 to 8 minute recess, and we'll do that now. Thank you.
Thanks. Sorry for the delay, everyone. Thank you very much. We'll resume the meeting, and the new letters have been put into the package, and that's regarding the pickleball. Right? Okay. Thank you very much. So we'll move on to the adoption of the agenda as amended. This is from Councillor Palladino. Be it resolved that the agenda of the regular meeting of the Cultural and Social Standing Policy Committee on Thursday, April 27th, 2022 be adopted as presented. Councillor Palladino.
I will call the question on that.
Question's been called. All in favor? Opposed? All right. We'll have a resolution from Councillor Carlson. Be it resolved that the minutes of the Cultural and Social Standing Policy Committee held on Thursday, March 17th be approved, and the chair and the city clerk designate be authorized to sign the same. Councillor Carlson.
Sorry, Mr. Chair. Any questions from my colleagues?
None.
I call for the vote.
Question's been called. All in favor? That passes. Let's go to presentations. We will call upon Dr. Michael Auld, please, for the 5.11. Step forward. Thank you. Welcome to this.
Thank you. And I appreciate the invitation to come back. Really like talking with City Council and appreciate the opportunity to work together with City Council as well. So I have a brief presentation and then happy to take some questions. I think I'm supposed to only talk for about 10 minutes or less, and I think I can probably do that. So when last time we presented to this committee, to City Council, was in December of 2021. And if I were to, we had a whole bunch of our stakeholders speak at the meeting, my take-home point was, wow, we have a really big problem and we need to work together on this. And I'm happy to say that today, just providing a really brief update, and I think that's really the first part. I think we can confidently put on our first slide that we're working, so Alberta Health Services is working together with the family physicians in the community, the Chinook Primary Care Network, and the City of Lethbridge to solve this problem that we all have. And why I think that's really important is that there's the risk with an issue like this that nobody completely owns it themselves. So you can say, well, of course, Alberta Health Services wants to meet health services, but those are services in the community, so is it direct Alberta Health Services thing? Well, no. You know, the Chinook Primary Care Network coordinates groups of physicians, but doesn't recruit on behalf of them. What I think is really good about the partnership that we formed is that we are at a point where we're saying if any one of those groups might be challenged to say we own this problem, I think that together as partners, we're happy to own the problem together and own some of the solutions. And that's really what I want to talk to you about today. So really just from an AHS point of view, there's 3 strategies that we are working with other stakeholders on. So if I can go to my first slide and hopefully deliver some good news to the group. Strategy 1 was to recruit international graduates, largely because our clinics just weren't getting interested applicants from Canadian graduates. We'd love to bring them on. I think there've been 1 or 2 that have come on, and that's been fantastic, but that's not going to fill a gap of 20 to 30 physicians. So we opened up positions to sponsorship, which is something that the college requires Alberta Health Services to sign off on sponsorship positions. Since that time, a ton of work has taken place, and I would have to flag a couple of the people involved. Our family medicine department head, Dr. Machali, who was at the last presentation, and Alicia Kerber, our recruiter, have really put in the countless hours that's gone from, well, why don't we recruit some international graduates, to where we are today. And forgive my graphics, what I'm wanting to show you there is that at this point, we think we've got 11 prospective recruits who should start work this calendar year, so by the end of 2022, and 3 of them have already accepted letters of offer. There's another 7 who are in the process. So a letter of offer has been written up for them, and we're somewhere in between them making a final decision. Sometimes they have yet to come and make a visit to the city, but these are people who are highly motivated, and we think that they'll come here. And then one more who's coming for a visit in May, and then we expect to be offering a position after that as well. The reason for the delay, the reason they're not starting tomorrow, is just the assessment period. They have to undergo 2 assessments, the first of which needs to be somewhere other than Lethbridge, and it gets arranged by the College of Physicians. The second one, they can actually be here working, and then they're being supervised by a physician here in Lethbridge. Each is 3 months long. There are various other things that have to happen with these candidates before they actually start work. So that's why our earliest start date, I think, realistically is probably going to be this fall. But that's actually pretty good considering what we've gone through. So between Dr. Micali and our recruiter, what they've done is they've reviewed over 100 applications. They've interviewed 27 candidates, and just so the other part that AHS contributes to this, the cost per candidate, because there is a cost for those assessments, the cost is between $59,000, $68,000 per physician. And so the cost actually isn't a barrier, and we've gotten the go-ahead to recruit as many physicians as we need, but it's something to be mindful of, is that there is a cost to this kind of recruitment. The other thing that we've learned through this, although we might have said in December, look, we're short about 20 doctors, let's bring on 20 doctors, there are multiple bottlenecks in the system. So it depends on what about the college's capacity to do the assessments? What about our ability to coordinate all those site visits and interviews and letters of offer and all the other things that have to take place? So our target was 2 per month, and I think we've done pretty well with that target up until now, to the point where what we're wanting to do is to say, okay, what should our pace be going forward? We know we should continue to recruit international graduates, but our ultimate goal is a balanced workforce of international graduates and Canadian graduates. So if we go to the next slide, I may have talked about some of this already, but essentially what happens to those graduates when they come here is where AHS, to some extent, we've created the conditions where they can come here and be sponsored. This is where we step away somewhat and the physician makes a decision. So what clinic do you want to work in? They're coming from different parts of the world, and they may not understand Canadian medical practice that much. So we're directing them towards the Canadian Medical Association. Jewel has some excellent educational resources, and we're really sending them there saying, learn how to manage a practice and what a clinical practice looks like in Canada, because that's going to help you to make your decision. We give them a list of available local clinics, and then they make their decision as to where it is that they would like to practice. If on the previous slide, the other thing that as a requirement for sponsorship, what we've asked them to do is to say, spend a little bit of your time doing something that we really know right now we're having a really hard time meeting some of those needs. So pain management, chronic pain, child and adolescent mental health are some examples of some areas that we know are really important to us, but we've got the numbers up there, but essentially that's what these physicians have been choosing as their area of interest. So then if we can skip ahead to our next slide again, I'll just say that we're going to help them. We're not just saying, we'll be interested in this and see how you do. So there's mentoring and a distance education program through the University of Calgary that is quite doable along with being in clinical practice, called CanReach for child and adolescent mental health. And we've got a way that we can arrange for mentoring as well for people interested in pain management. And then, again, just going back to my point is that what we want to do ultimately is wind up with a mix of graduates, and that's why we're thinking about what is our pace of ongoing recruitment for these people, and really brings us to the next strategy, which is our marketing. And for that one, so that's on the next slide, what we've done is to partner closely with the city, and I was just talking with Sandra right now. She's been a key player in that, along with Lethbridge Economic Development, Chamber of Commerce, to really market Lethbridge as a place that doctors would want to come to, so that we can improve on our numbers of Canadian physicians and Canadian graduates asking for jobs in Lethbridge. And the 4 pillars of what that strategy looks like is coordinating our activities together, advocacy where that's needed, really promotional materials, and I'll leave it to Sandra to talk a little more about that, and opportunities to partner. Our medical leader, who's done a ton of work on this and is really engaged in it, is Dr. Garland Yonker from the Campbell Clinic, and he's also our medical lead for community. So we've really been leaning hard on Garland, and not that we had to. Garland's actually been reminding us to get on with this part of it, because that's an really important part of the strategy. The final point on there in blue is on locum experience. And this is something that we'll take on through AHS Medical Affairs, but can align with the rest of the marketing strategy. What we've learned is if we're out there offering jobs to Canadian graduates, there may be up to a significant percentage of them that we've learned through some of our initial contact through our recruiters who actually don't want a job. They want to locum and find the place where they want to live. What that means is part of being successful is attracting locums and getting them to keep coming back and eventually decide that they just want to stay here. And so we'll do some work through medical affairs. Some of it, I'll speak to that on my next slide, but it's really just all around making sure that first off, we've got a place for locums, and then that they have a good experience when they're here. So with that, I'll go to the next slide, which talks about some of our upcoming action items for that strategy. Again, working closely with our city stakeholders is an advertising campaign and promotional materials. Secondly, we're going to be directly going out to residency programs. The contact hub will actually be the Chinook PCN, because they'll be the best one to direct those physicians, remembering that we hope that they'll want to have appointment privileges and be part of the work that AHS does, but they don't actually need to. They can come and practice in a clinic in the community, which is that's our biggest need for them right now. We're continuing to seek additional partnerships for our marketing plan, and then things like attending trade shows and conferences and really just being visible and there to answer questions. And again, on the final one, the locum experience, which we're taking on through medical affairs, it's thinking about where do locums stay when they come here. Right now, we put them up in a hotel, which is okay, but I think we can do better than that. What about recreation lifestyle? Probably good if they go riding a bike in the coulees and do some other fun things around here, and then that they're part of the social, even though they're not a part of the community yet, that they're part of some of the social activities and they get to know people when they're here working. So that's our marketing strategy in broad terms. The final one then, on the next slide, is we've recognized that why are we doing all of this together in the first place is to meet all the healthcare needs that are out there. And even when we were up to our numbers of doctors, there was still a lot of unmet needs, and there were approximately 24,000 unattached patients in the Chinook PCN area a couple of years ago. So unattached just meaning that they don't have a clinic that's their home. They're going to have to seek their medical care elsewhere, emergency departments and whatnot, which is really not ideal. Or, as our specialists will tell us, specialists hanging on to patients that they don't really need to be seeing, and they could see somebody else if those patients could be looked after again and transition to primary care. So everything from seniors to, again, chronic pain, there's people that are homeless, nutrition problems, bloodborne infections are a specific one that our public health people are really interested in, making sure those people get follow-up, and some of the people with complex chronic diseases, and a lot of mental health and addiction problems. So how do you meet some of those needs? And I'll go to the final slide, and this is one that we're really talking a lot with the PCN about, and in May we're going to have some upcoming meetings with the PCN to talk more about, and it's really just talking about opportunities to collaborate and be innovative about how we meet those needs, because we know from the experience of a couple of years ago, numbers of doctors alone actually doesn't completely solve the problem. additional strategies that we want to look at along with the PCN are things like, there's been a fair bit of talk about a family medicine teaching clinic, expanding family doctor teaching so that we actually have an academic clinic here in the city, which those exist in Edmonton, Calgary, but not in Lethbridge at this point. They would really be dedicated to teaching of family medicine residents, which would increase our capacity and also give those residents exposure to the community, again, making it more likely that they're going to want to stay here and take up practice here. We're having discussions with Alberta Medical Association on how to be innovative and make sure we've got practices that meet the needs, and really interested in talking with any other partners that are out there. We're hoping that more ideas will come forward through this, and we know that in May, AHS intends to have engagement session and invite multiple stakeholders, including, we'll invite participants from the city as well, and really just to talk about a little bit more about what might be some of the ideas that would be helpful. And what we think is that as much as possible, all those innovative ideas, and we've heard a lot of ideas between last December and now, they're excellent ideas. We think that we should find a way to steer them through the primary care network to some extent, because we want to make sure that they meet all the requirements. An example being that, that's one of their principles, is that people should have their medical needs met within what's called a medical home. So they belong there. It's taking a long view of their health, so not just the problem of today, but what preventive things should we look at and that sort of thing. And Chinook PCN this is what they do. So we want to make sure that they're really leading the next steps on how we take on how do we be innovative and how do we meet all the needs that are out there. That's my summary. Happy to take any questions that people have.
Great, thank you very much. I'm sure we have questions. I'll just start off with a couple. Just when you're talking about seeking international graduates, are you also do you try to search international doctors, period, that have been working for a while? Is that part of the search, or are you strictly going for new graduates who need to go somewhere?
Yeah, that's a really good question, actually. So when just how we would define an international graduate is an international graduate who requires sponsorship. So if the person's already been out there practicing, they're and good that you make that distinction. They would be like a Canadian graduate. It doesn't really matter where you went to medical school, but if you don't require a special license from the college, please come to Lethbridge, start your practice, and you can start tomorrow. It's the international graduates who next step for them is they'll require sponsorship and a period of assessment before they're able to start practice, and that's really the ones that we're talking about when we talk about international.
And when you reach out to these particular graduates, do you offer, is there incentives there, or is it just, here's an opportunity to work? For right now, is it just, we've got a place for you to work, or are there more incentives, whether it be whatever that incentive would be, whatever the carrot could be?
That's a really good point. And so up until now, like you can see where over 100 applicants, and because people are interested in coming to Canada and starting practice, and they're very excited about the opportunity. So we haven't had to offer incentives per se for recruitment, but really it reminds me of an important point with this whole strategy, that it's a recruitment and retention strategy. It does us no good. Ultimately, they're going to be with us for 5 years if we've sponsored them, but after that they're free to practice wherever they want to. We want to keep them though, and so then that's more so where I think that'll come into our second strategy on marketing and recruitment and retention. So in other words, the incentive will come down the road. We have to be very mindful of this being a good place for them to come and want to practice. And that's part of educating them up front, so they can start right away in the clinic that's their top choice and that's a good fit for them, and start a really good relationship with their clinic.
I just want a clarity on what you mean by a locum. What specifically does that mean?
Locum would be a physician who is not working here full-time. So when we if you look at the fine print of the letter of offer, it says you'll set up full-time practice in the city of Lethbridge. So it's somebody who's not in full-time practice in the city of Lethbridge, typically from somewhere else, who may be interested in some work for a period of months, but they're actually not at this point contemplating moving to Lethbridge and taking on that full-time practice.
But your intention would be say, well, you're here anyway, you may as well stay for 10 years.
Exactly.
Right. Okay. Maybe to Sandra, if you're involved in the recruitment, I mean, what will be or Dr. Old, what is the selling point for a new recruit, would you say? Who wants to take, if you want to take that, yeah.
I'll let Sandra start.
Thank you very much for that question. And really, it's been wonderful to work with our partners at AHS in terms of building a strategy that will serve this need, which is a priority for council moving forward. And what the research is showing that I'm doing is that it's not necessarily financial incentives that will bring a doctor here to stay. It really is about the lifestyle that they can have, that they can offer to their families. And we're going to talk a little bit more further in this presentation when Carly presents the action plan. But it is interesting to note we've been talking to major centers, much smaller rural centers, and that theme is consistent, that it's about lifestyle and the life that a physician can build here in Lethbridge.
Thank you. Just to ease Carly, we've got the package right here that we know is what we're going to be talking about as we go further. Mayor Higgin, I see your hand is up.
Thank you very much, Mr. Chair. Appreciate this opportunity to chat, and wanted to really thank Dr. Auld for the presentation today, but not only that, for the time, the commitment. I know you're a very busy individual, and be able to take that time and to work with your colleagues and with the colleagues here at my colleagues at the city. It's I guess enough more than thank you very much as we work together with the stakeholders in our community. I had a little question about locums, and Councillor Campbell had mentioned a little bit about what a locum is. Now, you mentioned earlier in your slide presentation of the 3 months that a doctor will go out and work in an area before they could actually have their practice set up in that area. Would that be considered a locum as well? Is that what would be that definition?
So they, I think the short answer is when they're in that other place working, the first of the 2-3 months assessments, it's called it's a PCA, but I won't bore you with acronyms. But for that one, they actually have to be directly supervised, so they can't work independently. So they can't really add to the number of patients that can be seen beyond the physician who's already supervising them. In fact, probably that's one of the reasons that it's compensated. It probably slows that physician down somewhat in their work. The second part, which is the acronyms, it's supervised practice assessment, or a SPA. That one they can work independently. They're just checking in with a mentor every week, meeting all the college requirements, who then reports back to them and says how things are going. So that the person on the second part of the assessment will actually be they're able to work independently. So they might look like certainly they could function much more like a locum other than that supervised part. One other point that reminds me of mentioning is just in terms of solving some of those bottlenecks, a really important partnership that we've dealt with in the background is those physicians aren't necessarily clamoring for those assessment, can I assess people? But because we've got a big stake here and say, well, we want to assess people because we want to hire those physicians, the problem is that if that first part has to happen somewhere else, how do we entice physicians somewhere else in the province to be interested? And we've built a really good partnership with Medicine Hat, who said, we're going to be doing the same thing, so we'll do those assessments that are people that can't be assessed in Lethbridge, and in return, once a physician's done that training, gotten comfortable with the assessment process, then we would think we would return that favor for Medicine Hat. So that's a really important thing to flag.
Great. And I wanted to just touch base as well. I was watching the news here, and they were talking from BC and the mass exit of doctors from BC that I'm noticing here. Comox was in particular in this news release because of the cost of housing and the cost of just the cost of living in general. So retention being such an important part, as you mentioned, we want to bring these doctors in, of course, recruitment, but retention is such a big part of that too. And so, looking at what we can do, I'm really confident that together with, all the key stakeholders we have, that we can offer that to come to our community. So thank you very much again for the presentation. Thank you for taking the time to work through this with the city and our other stakeholders. Appreciate it.
Thank you.
Thank you, Mr. Mayor. And Dr. Old, you can never bore us with acronyms. We live for acronyms in council. I see Councillor Palladino.
Thank you, Mr. Chairman, and thank you, Dr. Auld. Just a clarification, you spoke of the unattached population. Has that dropped in the last 3 months? Because I thought in December you said there was 40,000 people in the region that were unattached.
Right, and so, and we know that we had 24,000 in back in 2019 when the Chinook PCN started to look at it. So you've hit a point where we need to do some work. So say the good news is that we've come up with a data sharing agreement with the PCN so that we can really define who are the unattached patients, because what happens is PCN doesn't know when have they come to emergency. That's an AHS in our database, and yet we don't know when they're coming for certainty. Is this an attached or unattached patient? So we came up with a data sharing agreement and a real-time database, which is actually huge, because oftentimes the databases lag by 3 or 6 months. So we can tell you what happened 6 months ago, but we can't tell you what's happening today. This one is now real-time, and I'm thinking if I don't bore you with acronyms, you're okay with me talking about dashboards too, because I'm pretty excited about it, because it's actually, as we start to solve the problem, we're going to be able to, we'll see that, and plus we've got really good definition of what are the numbers and things like that. I will say that we've had a lot of, the reason I laughed a bit, we've had a bit of discussion about what is that number, and PCN has estimated it as upwards of 40,000. We, based on this new dashboard, when we look at it and some of the number projections we have, we know it's more than 33,000. We know that our attached numbers have gone down since 2019. Stay tuned, and I can give you a more accurate number.
Thank you.
Councillor Schmidt-Rempel.
Thank you, Mr. Chair. And thank you, Dr. Auld, for all the work you've done on this. Ms. Dufresne, Ms. Kleisinger, thank you very much for the work that's been going on this. A couple questions, just taking a look at the action plan that we've got. Insofar as the marketing component goes, do we have specific areas, countries, regions that will be targeting that marketing to for doctor recruitment? Or have we determined that yet? So we're just pulling those materials together?
We actually have a meeting coming up in a couple of weeks that is, I would say, will be the kickoff to what marketing will look like. So this is timely in some of the asks of recommendations that we put forward of how council may wish to participate, but that work will happen either way, and I just have a feeling that the more we start to dive in, more players will come to the table. We know there's some interest from the County of Lethbridge and others that'll grow into a bigger committee, but as of right now, there's those discussions are just a little preliminary.
And I guess just to follow up with that then, and maybe Dr. Auld, you can answer this, will we have doctors being able to step up to market our community to other doctors?
Yeah, I think that's a really important point, and just largely, this will be the exciting thing about this. We'll be able to define better who's our market, who are we wanting to aim at. Our recruiters will already tell us that if you kind of think of it as concentric circles. So within the province, go to Edmonton, Calgary to the training programs, and then adjacent provinces, etc. We can go as far as we need to across the country to find people, though. And absolutely, we know that we'll need, and we've gotten a lot of a real strong sense of people wanting to be helpful with that. So we think that that's more effective, is a physician along with a recruiter at a marketing meeting, as opposed, or whether it's a trade show or a medical conference or whatever. Put the two alongside, a recruiter and a physician is probably the best model. We'll have to, the challenge, of course, with our family doctors is that they also were short, so they're pretty busy here. But we think that with things like Zoom meetings and that kind of stuff that can be done these days, we'll be able to pair them up, and that's probably the best model of how to do it.
Thank you.
Just a quick question for Carly on the ask from council contingencies, your $15,000. Is that, do you feel that's going to be enough?
The reason the number is what it is because I do believe as we start these conversations that there'll be a lot of players coming to the table. So I would say that would be a piece of a starting part, good contribution for council. And then as others kind of see that we set the bar on a contribution number, that they may come to the table with matching dollars, and that'll continue to grow that way.
Thank you. Do I have any other questions from Councilor Middleton Hope? I do not see you. But,
I was wondering why I was being
sorry.
left to laugh.
I'm sorry. Yeah, go ahead.
Dr. Auld, thanks very much.
And time is up. Sorry.
Yeah, I knew it. Dr. Auld, thanks very much for your presentation. It always provides me with a ray of hope when I listen to some of the comments that you make. I'm going to ask you a question in regards to gap analysis. Have we done anything in regards to looking at what skill sets we are missing in the community and what skill sets we need to be looking for? I'm thinking specifically of the cath lab and the future having to staff that hopefully sooner than later. So are we conducting any kind of gap analysis, or is the gap so large that it's really a chasm?
There's probably a couple of points, and that's really that third strategy, working with the PCN, is focused on that. So when there's some work that we I mentioned that the report on unattached patients was all that research was done in 2019. Well, here we are in 2022. So what happened? Unfortunately, a pandemic happened, and people were focused on all kinds of other things. But it's a rich source of what are some of the unmet needs, and what are some of those skill sets that we know that we need in the community. Some of them are obvious to us, like the chronic pain, where we're down to one physician to meet needs that one physician couldn't possibly meet, and some of the adolescent mental health stuff. But there will be more as we do that work with the PCN. And I would say that the city has done some good work, good collaborative work in recent years as well, in kind of through the community wellbeing safety strategy. That's another good source of looking at what do people need. Then in terms of specific skills, it's the art of matching up the physician's interest with what is needed out there. And then the other part, that's where we talk about innovation, is how can they, oftentimes some of those things are more, it's just more difficult needs to meet. When your person with chronic pain is that it just takes a lot more essentially physician hours in order to look after a population like that. So how can we work with the physician, finding innovative ways that they can extend themselves and partner with AHS, because AHS has a lot of resources, a lot of wraparound services that we can offer to those kind of clients. So it's kind of building that part of it together. But really important point, and I would turn to our third strategy. Will be the one where we'll be able to do more work in that area.
Okay, thank you. And one last question in regards to support for families and spousal employment. Are we looking at that? And in tandem with that, are we looking at a program of debt relief that might also work to entice future physicians or physicians that have practices elsewhere that want to move here?
I'm pretty confident all those things are being looked at by the marketing strategy. One of the challenges we've got within, from an AHS perspective, some of those things might, if they at all look like compensating physicians, we can't actually do that because Alberta Health does that through the fee schedule. So some of those other things though, brilliant strategies. We're a city that's got a university and a college and all kinds of opportunities for a spouse, and probably haven't paid enough attention to. I know of physicians who've been here in the past with really highly qualified spouse who chose to stay at home because there just wasn't the work for them. So I think that's a really important thing that we need to look at.
Thank you.
Councillor Carlson.
Thank you, Mr. Chair. Do appreciate the presentation. I was holding my questions because I maybe was mistakenly under the impression that there was more to the presentation on the marketing strategy. Is that still coming, or we just were to read that and ask questions?
That's just in the package. That's just for your information. So no, there will be no more presentation on that.
Okay,
Right.
Thank you for that. Then a couple of quick questions. Some of them have already been answered. Through you, Mr. Chair, to I don't know if we have Mr. Matthews online, but I'll direct it to City Manager, his designate. I don't recall whether I know previously in budget cycles, we had approved budgets for various committees like the SPCs or advocacy, et cetera, et cetera. Did we remove those budget lines? Do any of our committees, and most specifically the SPCs or any other council committees such as advocacy, still have budget lines attached?
I see Mr. Vanden Heuvel has his hand up here. I'm hoping he can answer that for you, Councillor.
Hope away. But yeah, no, those budgets were still within that 2019 to 2022. So the budget lines exist to the remainder of the end of 2022. The allocations aren't as structured as they were to the former OEG as the governance structure in the SPC. Things has changed. So there are amounts in there, and if there is specific ones that you want us to look into with what a balance in there would be, I'm happy to do so.
Thank you, Mr. Vanden Heuvel. I appreciate that because I couldn't remember when we rolled into SPCs what we did with those budget lines, but we seem to dip into council contingencies as the backstop for everything. But I'm wondering, this is sort of an advocacy initiative, perhaps, or perhaps this SPC's initiative. If there are budget lines that flow to the committees or that are available to the committees, I'd be keen to know if we could access those or utilize those for these types of campaigns. So I don't know how long that would take or if we can find that out. It probably doesn't need to happen today. It'd be quicker if the committee could just approve funding from a certain budget line, but if not, it would have to go to council.
Carly would like to speak.
Councillor Carlson, the video that we did that came from Advocacy Committee that you're probably recalling that is due, we're going to bring it to council very shortly. It's complete, so you'll be looking forward to that. That was approved through council. So there isn't specific dollars for Advocacy Committee, some of the bigger SPCs, but not Advocacy Committee, which is why I think when I asked Daryl what the appropriate funding source could be, that's where council contingencies came from, just because it's a smaller dollar value. So that's where that decision was made, because Advocacy Committee specifically doesn't have that.
Okay, thank you for that. And I council contingencies is sort of a good backstop for these things, but I was just wondering this for the sake of speed and efficacy or efficiency, if the committees did have budgets attached to them, they could maybe approve those dollars without having to go to council. Of course, we keep council informed, but it'd be good for us to know if we could just approve those out of our budgets, if they do exist, which I couldn't remember. So I'm hoping, Mr. Vanden Heuvel, you could remind me when you can find that out. Appreciate that. Thank you, Mr. Chair. Further question, if I can. And I think Mr. Frayne and maybe Carly, Ms. Kleisinger, we're going to talk about this a bit. The marketing, I think Dr. Old talked about retention. Once the 5 years is up, we've got to have a reason for folks to stay here. Are we diving in when people do leave our community? Is there any way we can, like an exit interview type idea, to say what would have kept you here? I mean, I know some folks would say, you know, I'm moving to Calgary because well, I'll put something I'm thinking. I've been waiting for a performing arts center for 20 years. Council has been talking about it, not doing it. I would like a city with that. Are we looking at those types of things? What we could invest in as a city council for our community that would not just attract but retain people here? Do we have any of that information?
Maybe I'll take it on first. What we've learned from the exit interviews was relatively unsurprising. I left because I retired. I left because I wanted to live somewhere else, but you know, it just seemed like a nice place. I think where we want, an absolutely important point though, I think it goes back to what Sandra talked about. What are the reasons that people stay? And if it is an art center, then well, let's build that. But it may be the relationships that they've built with people and the feeling that this is where I want to be, and I ski every winter, and my kids are in school here, and why would I want to be anywhere else? And we're planning to have them go to university here. And I think that it's no small thing, right? Building that connection to the community that we're in, and thinking that these international graduates are coming from other places in the world. I think it's going to be really important to work on that part of it, and making sure that they want to stay at the end of the 5 years. But it's less satisfying. It'd be nice to know that it's this thing. Give them this thing. But I think it's more complicated, but it's also doable.
Great, thank you. And I got to say, I agree. Why would anyone want to be anywhere else? It's an amazing community. Thanks, Mr. Chair. I'll hop out in case my colleagues have other questions.
Do we have any other questions from anyone? I see none. Mr. Carlson, did you still want to ask another question?
Sure. Thank you, Chair Campbell. Just maybe if Carly or Sandra could talk us through the campaign. There's talk about the $15,000 from contingencies, and there's talk about possible other partners. I didn't see a budget, so I'm not sure exactly what the dollars are going for and how much we're hoping to leverage to other partners. Is there any of that information available?
Speaking to what both Dr. Auld and Carly mentioned, that this initial budget amount really is the seed money to bring other partners online. And we know those partners are there. They've identified their interest and their own need, especially with Lethbridge County. And really the way in which our municipality can support this important work is by marketing our municipality. And I'm very anxious for everyone to see the video. It really is 105 seconds of the very best that Lethbridge has to offer. And our research has told us that the things we're highlighting in the video are the reason that physicians and their families will make a commitment to our city.
And thank you for that. I'm excited. I was part of council and the committee that $15,000. What if no one else, everyone says, yeah, we want to partner, here's our zero. What are we going to be able to do for $15,000?
Yeah. Councillor Carlson, sorry, I just cut you off. That was rude.
That's sorry. I'm trying to see you.
Can you see me?
Nope.
So the submission that you have in your package is what council directed to come back, which was an action plan, and marketing is one of those pillars. And so I think if I can get to the crux of what you're trying to ask is that We've broken it down into four different categories. So just let me make sure I get them right and in the right order. So we believe, as part of this action plan, that we need to do 4 things, and one of them is coordinating. And so that gets down to, if people come to ask us a question, we can connect them with Dr. Auld. Dr. Auld can connect them with us. We can connect them with EDL. It's making sure that we're all taking a coordinated approach. Advocating is that piece that we know as council is really important to you, and that's making sure that if we need something for the community that's with another level of government, we go after that, or we do what we need to. Then the marketing piece is the one pillar, and the other one would be that exploring incentives and partnerships. And so that's where we'll see, I would work closely with Opportunity Lethbridge on some of the work they're doing on their greater economic strategy, and that's exploring, is there types of incentives that may make sense for City Council to get involved in. I don't want to guess at what those might look like as opportunities come forward. And so it's kind of a short, medium, and long-term strategy in this action plan, because those are the ones where the dollar values probably haven't been seen yet. Those would be, if council were to want us to continue down this road, which I think is probably the case, those asks will come back to council at another time. And that's where you might potentially see greater asks for partnerships with others in the community looking at incentives for medical clinics.
And thank you for that. So I guess maybe I'm just a little unclear on what can we do for $15,000? Is it all of what's in the briefing sheet here, or is it, well, we're hoping that our 15 will get another 15 from X, another 15 from Y, another 15 from Z, because if we have 60,000, we'll say, we can do these things that are outlined here. Is that the goal, or is it that we'll just 15,000 is going to get us these things, and then if more partners come on, we can do them 4 times better?
My personal goal would be for council to lead in saying this is important, the marketing piece is important, and that lifestyle piece is something that we are already working on. And so I don't think we would chuck 15,000 out and say, here's to hoping something sticks. It would be waiting for other partners to come on board and then coming up with a marketing plan that makes sense. And my number one goal in that marketing plan would be that it suits the needs of the City of Lethbridge's goals within our jurisdiction. And I feel like a lot of that is lifestyle. That is getting people to want to live here and stay. It's what's great about this community, and sort of changing that story about, let's get rid of some of the negative noise and start saying, to heck with all of that, we're moving forward, and this is a really great place to live, and we all know it. So I think that we would be heavily involved in the process the whole way to say, hey, City Council's really, really invested in this marketing plan, but making sure that your needs are met from the City of Lethbridge.
Thank you for that. Appreciate that. Final question, if I can. Mr. Chair, cut me off if somebody else jumps in. The dollars are kind of outlined here, how they could be utilized or what they're hoping to achieve. What kind of HR time is this going to take? And maybe this is the city manager. And do we have the capacity to take this on?
Again, I would get Ms. Kleisinger, who's really been instrumental in all of this, to jump in. But yeah, I think to a degree, Carly, if you want to weigh in further, where we do have capacity to do some.
Yeah, I definitely think that the good part is that this is a key part of my job as well as Sandra's job, and communications that's already marketing our community in a different way. So it fits nicely with the work that we already do, and shouldn't be anything that would be too crazy and doesn't fit with already our job descriptions.
Excellent. Thank you. Thank you, Mr. Chair.
Any other questions from the committee? I see none. Then I will, I have a resolution by myself. Be it resolved that the Cultural and Social Standing Policy Committee recommends that Council 1 direct the City Manager to continue to explore opportunities for collaboration and partnership with AHS and CPCN and report back write a letter to Health Minister Jason Copping advocating for support and funding for an academic teaching clinic in Lethbridge. And 3, council allocate $15,000 from council contingencies to a family physician marketing and recruitment campaign in partnership with the Chinook Primary Care Network, AHS, and Economic Development Lethbridge, and other interested partners. For me, I think this you've done tremendous work. Thanks for being here, and this is just the continuation of a solid effort of getting our goal of more physicians in the town, in the city. So it's an important next step as we move forward. Any other councillors want to weigh in? Councillor Schmidt-Rempel?
Just to add on to that, I also like that we're certainly looking forward with the teaching clinic and those other opportunities that will build that capacity within our city and region. So that builds not only on the retention, but looks future at our region to make sure that we are not in this position again. So I do thank you, and I appreciate for that component of it.
Anyone else? Councillor Carlson?
Thank you, Mr. Chair. I just had a question. Exactly on the item 2, the academic teaching clinic. Do we have enough information to write that on our own, or is that something that Dr. Auld and our folks can collaborate on? I would just hate to say, let's write a letter, but we might not be saying the exactly what we need to say. Do we have all that information, or will someone provide us all the information we need to advocate properly?
Mr. Frayne.
Thank you, Councillor Carlson. And really, by way of example of the collaborative relationship we have with Dr. Auld, his colleagues at AHS, this would be a collaborative letter to make sure that it is complete and all the information is shared. So we'll work on it together.
Excellent, thank you. And it may not need to be part of the resolution, but if some sort of briefing note, elevator speech, etc., could be sent to all members of council. We interact with members of our provincial government quite often, cabinet ministers, MLAs, etc., and any opportunity we would get to be able to mention these types of things would be very helpful, especially to our MLA, Nathan Neudorf, who's identified this as a priority for himself. So if we can get all of that information to council so that we're well armed to help advocate, I'd appreciate that. Thank you.
And to add on to that, Councillor Carlson, Minister Copping was in town on December 17th, and this won't be the first time that he has heard from us on the topic, as Mayor Higgin addressed it. So we'd be more than happy to get that information for you in a one-page.
Excellent. Thank you, and let's hope it's not the last time he hears from all of us on this, and we wear him down. So thank you.
And make sure you put in Performing Arts Center. Just throw that in. You're laughing. What? Anyway, you've read the resolution. No other comments? All in favor? That passes. Thank you. Thank you very much for coming. Appreciate it. Thank you, Dr. Auld. Next presentation we have. Thanks for your patience. Tara Plato, CEO of Lethbridge Public Library. Report to the Community 2021.
Mr. Chair, before we begin this, because I do work for the Lethbridge Public Library, I will be recusing myself from this portion of the meeting.
Thank you.
Thank you.
Good afternoon, Chair. I'll have to tell you that I was arm twisted to come along with Tara as chair of the board. So we thank you very much for the opportunity to present the Public Library's 2021 report to the community. Thank you. 2021 was another interesting year for the library as we again faced mandatory closures and restrictions related to the pandemic. As the management and staff continued to find innovative ways to provide services to our community, during this process, the board also undertook a strategic planning process, and we've now developed a new 2022-26 plan of service. The plan of service is based on significant community needs assessment and responds to the current and emerging environmental factors, as well as best practices and trends in public library services. It provides a broad picture of the services and opportunities for the library over the next 5 years and will guide library staff in their work. So, you probably want to hear, though, of all the incredible accomplishments in this very difficult past year. We opened, closed, half opened, half closed, but our staff were phenomenal, and under Tara's leadership, we're able to achieve a great deal. Turn over to Tara. Thank you.
Thank you, Craig. If we can advance the slide by 2. Thank you, Janessa. As Craig said, our doors remained closed for part of 2021 and restrictions remained in place. As that happened, the library staff continued to find ways to meet community needs in safe and sustainable ways. So I'll provide you just a few highlights in this presentation. The library board, voted to go fine-free in 2021. Fines were temporarily eliminated in 2020 as a way to help support our community's access to the library and to the information and resources we provide. In light of a downward trend in revenues from overdue fines, the board voted to make this permanent in 2021 and removed a significant barrier to library use for many. This decision is in line with hundreds of other public libraries throughout the province and country, and the model actually prioritizes recovering library materials and has been proven to result in staffing efficiencies. No-fee memberships were also continued in 2021 as a way to ensure that every member of our community had access to the library. We launched Internet on the Go as a way to provide public computing and internet services while our doors were closed. Library customers can borrow a Chromebook or MiFi hotspot, increasing the ability for people to go online when and where works for them and helping to close the digital divide. Once again, the word on the street went virtual in 2021 in order to ensure a safe event for all. And of course, while we are excited to bring this event back in person in 2022, a virtual event allowed community members to connect with some of their favorite authors and included an Indigenous cultural programming stream highlighting local Blackfoot voices. The library continued to respond to the COVID pandemic in many other ways, including online programming, curbside pickup, and continued investment in online resources. And the library was also the recipient of a number of grants in 2021, including funding for an Indigenous summer program student. And we were also a partner grant recipient in Shaping Inclusive Societies, which aims to develop a pilot project to address financial literacy and empowerment amongst new Canadians. Next slide, please. People continued to make use of the library even amid closures and restrictions on programs and events, including circulation of close to 1 million physical and digital items. Next slide, please. We continued to work towards our plan of service, as Craig mentioned, in 2021, which expired at the end of 2021, which included providing value to the community through no-fee memberships and elimination of overdue fines, which I've already discussed, so we can move to the next slide. We cultivated and modeled community leadership by hosting various events leading up to the municipal election and provided public workshops that focused on diversity, equity, and inclusion. We were also able to enhance our Indigenous programming by hiring a temporary summer student, as well as adapting one of our permanent positions to have a focus on Indigenous services on a permanent basis. Blackfoot signage translations were also installed throughout the main branch. Next slide, please. We met community needs by providing online and grab-and-go programming, partnering with Alberta Health Services to provide COVID vaccination clinics and outreach, teen programming, which focused on connecting teens through shared interests, and through the Read On Adult Literacy and Learning program, which celebrated 40 years in the community in 2021. Read On developed the Moving Forward program last year, along with a workbook which strengthens the literacy and essential skills of displaced workers, and that workbook is now available to literacy programs across Canada. Next slide, please. We offered access to content and ideas through a variety of digital resources. The Bookmobile reached more people by expanding the book bin delivery program that they had developed in 2020 to over 40 school and youth organizations, reaching program capacity. We also took our programming outside when we could so that we could have some in-person programming and expanded partnerships to provide programming kits. We were also very excited to host Indigenous author Richard Van Camp as our 2021 virtual writer in residence. Next slide, please. We've learned a lot through the pandemic about how library services fill the needs of our community. And as Craig mentioned, we're very excited to carry out our next plan of service over the next 5 years. Thank you very much, and we're happy to take questions. Thank
you very much, Ms. Plato. My question to you, I guess, just sort of a esoteric sort of question, I guess. At the end of the day, after going through the incredible challenges that you've gone through from, drug use around the library, from renovations to from COVID, to all of those challenges that you've faced, and you're sitting there at home with a glass of wine and you're thinking back about all of you've been through and you've got through it. What's the takeaway for you?
I feel like there's many takeaways, but I'll answer. I'm not sure if Craig wants to give his own answer, but I think one of the things that was really highlighted for us over the last couple of years, and through those other things, as you mentioned too, they all really highlight for us the importance of physical space, physical materials. So, obviously we've been moving over the last several years towards a lot more digital, online presence. You can get your memberships online and you can borrow books online and that sort of thing. But closing the doors of the library in particular, as well as some of the other challenges faced in our physical spaces, has really highlighted that physical space is really important to the community, and it provides so much more than a place to borrow a book. We haven't been able to have really in-person programs for 2 years, and that we've heard over and over how much that impacts families and children with socialization and people, who just need a place to be that maybe isn't their home, or if they don't have a home. So for me, that's probably the biggest takeaway from all of those things.
And I'd probably add to that, I would say the staff were incredibly innovative in meeting all of those kinds of challenges that you outlined. And certainly they never shied away from dealing with some of those issues and some of those problems. And I think they've handled everything in a very positive and a very constructive manner.
Wonderful. Great answers. Do I have any questions from my colleagues? I see none. Thank you very much for the presentation, and well, here's to a bright rest of the year and years to come. I have a resolution from Councillor Palladino. Be it resolved that the Cultural and Social Standing Policy Committee receive the presentation and report as information. Councillor Palladino.
Sorry, if there are no questions, I would call for the motion, vote.
Okay, question's been called. All in favor? And no one opposed. That passes. We'll just wait for Ms. Schmidt-Rempel to reappear. In the meantime, we have 5.3, Takara Motz, CSD Operations Manager with the Community Wellbeing and Safety Strategy Contract Management Updates. Is she online?
Takara's sitting right here beside me, and yeah, she'll be giving an overview of the grant side of community social development.
Okay, sorry about that. Just we're getting our other member of the committee here, and she's back.
Good afternoon. My name is Takara Motz. I'm the Operations Manager for Community Social Development Grant Management Team. In late 2020, we operationalized the Community Wellbeing and Safety Strategy and would like to share some key highlights with you today. Next slide, please. Key to the implementation of the CWSS was recognition that the social services ecosystem is integrated, and therefore our investment strategy needed to be integrated as well. The CWSS funding portfolio supports services starting with early intervention and prevention to secondary and tertiary interventions like supportive housing. Performance excellence strategies were implemented to ensure that funded programs were meeting intended outcomes and operating in alignment with best practices. A community committee was developed to provide oversight and recommendations. This is known as the CWSS Advisory Committee. Next slide, please. Community Social Development adopted an integrated funding portfolio under the CWSS, with primary funding sources including Family and Community Support Services and Outreach Support Services Initiative from the Government of Alberta, Reaching Home from the Government of Canada, and municipal funds through the City of Lethbridge. All CWSS allocated funding falls under one master agreement for each provider and was allocated under one procurement process, which was an RFSQ that closed in early 2020. As the grant manager, CSD is required to ensure that all agreements comply with federal, provincial, and municipal procurement, financial, and operational directives. Each of these grants have specific restrictions, and therefore utilizing an integrated funding model allowed us to meet service needs in the community while ensuring that funding eligibility under each stream was maintained. Next slide, please. The CWSS grant management process begins with confirmation of funding and the CWSS budget. In 2019, CSD completed an intensive needs assessment to define the service needs in our community. Based on this information, an RFSQ procurement process was developed and evaluated, beginning with a technical analysis and then working with our CWSS Advisory Committee to develop funding recommendations. Once allocation recommendations were finalized, they were brought to and unanimously approved by Lethbridge City Council. Funding agreements were developed by city administration with input from the service providers. Once agreements are executed, CSD staff monitor and support providers in achieving the greatest impact to our community. Next slide, please. The key principles that guide the work of the grant management team in CSD include ongoing assessments of performance. This is done through quarterly reporting and review meetings between the service provider and CSD staff. This collaborative approach has shown to improve outcomes and ongoing continuous improvement efforts throughout the agreement term, which limits the risk to the City of Lethbridge as the grant holder. System and program level key performance indicators were developed and included in all CWSS agreements in order to ensure that data-driven and outcome-based reporting and funding decisions are made. Examples of these key principles in action in our community have been included in the attachments today. We'd like to thank you for your time and open up for questions.
Thank you, Ms. Maltz, for the presentation. Do I have any questions from members? Councillor Carlson.
Thank you, Mr. Chair. Thank you, Ms. Motz, for the presentation. The integrated funding strategy, it was embarked on, I believe, in 2020 or maybe a bit earlier. How's it working? Is it working in the way it was intended to provide greater efficiencies, oversight, better impacts and outcomes?
Yes, absolutely. It is working as we were hoping to. You can see that we start with services in the prevention and early intervention spectrum and move down the spectrum, and our funding sources align. Prior to having the funding sources integrated, there were gaps in our system and there were duplications of services, which we've been able to eliminate using this integrated investment strategy, as well as move forward projects through different eligibility criteria within each funding source. For example, with permanent supportive housing to move forward projects this year, which would have been challenging to do without an integrated funding model.
Thank you for that. I believe later in our agenda, we are going to be exploring or discussing the exploration of maybe splintering these off again. Is that something that is recommended, or are we seeing a good impact in having this integrated funding strategy?
I'll have our director, Mike Fox, answer that question.
Thanks, Takara. On that, I would say that there's many ways of operating these types of systems. In conversations with the province, it is working well, and even if the OSSI dollars went to another company, it would not alleviate the city of the obligation of monitoring the funds and performance managing them. So even if the OSSI funding was given to another agency, the same criteria would have to be held by the city unless the province decided to give directly to another agency. So it wouldn't change how community social development operates. It just would limit the procurement process, and that other body would have to do the procurement process. So again, in a review of the OSSI funding, there is many ways of doing it across the province. However, the agreement is still between the city and the province, so we have to make sure we are fulfilling the funding obligations with the province.
Excellent. So basically the mechanics would be the same, but we may lose some of the benefits of the integration of those funds being overseen by one group. Is that my understanding, or is that not?
In a way, yes, but in a way, no. So again, that's where, again, I'm not the expert in the OSSI funding model, and that's where there's differences of opinion across the province on the best way to do it. However, it doesn't change the city's obligation unless the province changed the way that they fund municipalities. So our obligation would still be to performance manage. Part of it would be we wouldn't have to do the procurement. That would be the third party that would be doing the procurement for the OSSI, although we would still have to monitor the one agency looking after the other agencies. So it just changes the model. And again, it is quite a complex system. But again, as administration, we are fine with looking at other models. There are always differences of opinion, and we just want to have the best for our community.
Thank you. Thank you, Mr. Chair.
Any other questions from the committee? I see none. I have a resolution from Councillor Carlson. Be it resolved that the Cultural and Social Standing Policy Committee recommends City Council receive the report and attachments regarding the community well-being and safety strategy contract and management updates for information. Councillor Carlson.
Thank you, Mr. Chair. Unless there's any other questions from my colleagues, I just want to say we appreciate the updates and we appreciate seeing some of the metrics and outcomes. So I hope we can get this to Council for their review as well. Thank you.
The vote's been called. All in favor? That passes. Moving on to submissions, 6.1. Travis Grindle, Recreation Services Manager, about updates to the sport and recreation policy, which was last reviewed in 2015. Is Mr. Grindle online?
I can text him if you'd like. It is a submission. If there's questions, I can try and answer, but I will see if he is coming down.
Yeah, I guess the main question, just mostly this is kind of an update, mostly housekeeping for this report.
Correct. It is bringing the policy forward. It hasn't been updated in quite a while, so we're bringing it up to date with changes that has happened in the city and making sure that we're meeting the need of the community.
And having read through it, there doesn't seem to be real drastic changes to it, just sort of lots of wording and things.
Correct.
Yep. So are there any questions from my colleagues here on this matter? I see none. Then I have a resolution from Councillor Palladino. Be it resolved that the Cultural and Social Standing Policy Committee recommend the City Council approve the proposed changes and updates to the Sport and Recreation Policy CC31 as presented in Attachment 4. Councillor Palladino.
Chairman, As you mentioned, it's a housekeeping matter, basically bringing up to the changes that the city's been going through in this matter. So if there isn't any other questions, I would move that we move to vote on this.
Okay, question's been called. In favor? That passes. All right, moving along, 6.2, Jillian Bracken, Community Arts and Culture Manager, Re the Legacy Park Picnic Shelter Public Art Project and Artist Selection. Is Jillian here? Or is that you, Mike?
I can try and answer the questions. I have texted to see if anybody is going to be online to answer questions.
Here comes Jillian now. Yeah, Jillian, you're on. You're on. Oh.
Yeah, Jillian, there wasn't a question yet. We're just starting yours.
Sure, Jillian, just if you want to step forward, Jillian, just again, when we're talking about getting artists to do work, there's always a way to do it, and it's the age-old question: why is someone from London, Ontario, the artist, and not someone from West Lethbridge? So just remind everyone how this works and how it's important to do it this way.
Absolutely. My apologies for being a little late. We were watching upstairs and the elevator was stuck, so we ran down as quickly as we could.
Oh, I thought there was a game on or something. No, okay.
There probably was as well. Councillor Campbell, public art adheres to all of the city's procurement rules. So for projects over certain thresholds, we are required to compete them. So for this particular project, because the dollar threshold was over a certain amount, we put the project out via an RFP and then follow the competitive processes similar to all of other city contracts. So receiving proposals in, evaluating those using criteria that's communicated to all the artists, and then selecting them, working with a community-focused ad hoc selection committee. And for this particular project, that committee selected Susan.
Right. Susan Day from the Partridge Family. Good.
I don't think it's that Susan, but I could be wrong, yeah.
One thing just mostly a comment is just that what's really nice about this is that Susan becomes a mentor in Lethbridge. Explain what that involves and how significant that is.
Absolutely, and that's actually a component that we are trying for the first time, trying to balance that involvement of artists from outside of Lethbridge with involvement of artists from Lethbridge and area. So this allows a local artist the opportunity to work with an experienced public artist to develop skills and have exposure to a particular artistic medium that maybe they don't know a lot about. With this particular mentorship as well, the artist will have an opportunity, the mentee will have an opportunity to actually actively be involved in the installation of the mosaic, which is great kind of life and work experience, and a way, like I said, to balance that outside involvement and the benefit to the community that comes just from having public art as part of our community with that kind of targeted professional development investment in a local artist.
Thank you. Any other questions? I see none. Thank you. I have a resolution from myself. Be it resolved that the Cultural and Social Standing Policy Committee received the report as information. All in favor? That passes. Okay. Moving on to 6.3. And Robin Harper, General Manager, Recreation and Culture with Legacy Parks Pickle Courts. Do we have members of the pickleball club that are here? Okay. Is that Blair Richter, Ilsa Wong, Klaus Witzke, and Leo Torres? Oh, okay, sorry. Blair's from the Parks Department, sorry, okay. Sure, I just, I guess the big question that is before this committee is which suggestion that we want to go with. Do I have questions from members of the committee? Councillor Carlson.
Thank you, Mr. Chair. Just a question on process to either yourself or Mr. Westerson or City Manager. Why is this coming to this committee? When I read it, I thought either economic, which is all of council, who she created the CIP, may want to weigh in, or Civic Works. I'm just wondering why it fell to this committee. Maybe there's a good explanation. I just missed it.
Anybody want to take that?
I wish I had a good explanation, Mike. I don't know. Civic Works does make some sense. I'm assuming there was some direction previous that's brought us back to this point. Mr. Fox?
Through the chair, I'm not exactly sure. I believe it's usually Rec and Culture does come through the social and cultural committee, and this was a joint effort between Rec and Culture and Parks on the CIP program, and usually sports or anything to do with the sporting does come through the social and cultural SPC. So I'm guessing that is the reason. I know that there is some decisions to be made around the CIP, but I don't know, I'd have to refer to Robin or Blair if there is a change in the actual amount of money that the CIP is requesting. It might be all within the CIP amounts that are currently present, and if that's the case, there wouldn't be a financial decision. It's more of a choice on the direction council would like to go within the CIP for the type of sports that are being discussed. So that would be my explanation on that.
City Clerk wants to weigh in. You.
Sorry. Just was going to echo the mandate of the cultural and social SPC has within it the parks usage, recreation, neighborhood services, recreational activities, general leisure programs, and so that would be some of that. And yes, you're correct as well, Councillor, with regards to the CIP belongs to economic SPC. Believe this SPC with the recreational component there and the cultural side and the neighborhood facilities to generate a little bit of that discourse, notwithstanding that could have happened at economic SPC as well.
Okay, yeah, thank you for that, because I think we are still new in my mind to SPCs, but I guess if we were building the ATB Center, which is a recreational facility, I don't think it would be this committee stewarding that. So that's why we might want to sort of tweak some of those things that come to different committees. There are some that are better positioned to discuss civic work projects, even though they may have a recreational component. That was just my question of thought. Following up on that, Mr. Chair, can someone remind me, was this D30? And I'm trying to pull old memories out of my head.
Yes, D30.
This was D30 in the CIP. What was the budget line for D30 that was approved?
Through the chair, I have confirmed that all the requests are within the current budget. There is not a budget request. It's more about discussion around the courts itself and what would service the community the best. But it is all within the CIP budget.
Okay, thank you. What was that total budget, if you can remind me, Mr. Fox?
Councillor Carlson, I have that. It was $650,000.
Okay, thank you. Further question around that. What was council's approval in the CIP? What did council approve?
Council approved the construction of 6 new pickleball courts. And just to reiterate some of the previous question that was asked, I think the main intention of this meeting was to actually provide an update on the engagement results around preference of repurposing the existing tennis courts for pickleball usage. I think that's why it was brought to this committee meeting.
Okay, thank you. So just because of process, I just need to understand. Council approved very recently the CIP, approved, I'm going to say $650,000 for D30 to construct 6 new pickleball courts. What changed? What's causing administration to come back and say, here's what council approved, it's in the budget, we were given marching orders to go forward, why is it coming back with, or something else?
Thank you for the question. I'll just defer that to the General Manager of Rec and Culture, Robin.
Thank you for the question, Councillor Carlson. You're correct. The CIP was approved for construction of 6 new pickleball courts. And the intent was it would be adjacent to the existing pickleball courts at Legacy Park. After further discussions and a little bit of research, it was determined that there may be an opportunity to repurpose the existing tennis courts, which are right next to the existing pickleball. So we did look at that. The other factor that was involved in that, there was some information in relation to the area where the initial new pickleball courts were scheduled to go. There was some concerns about irrigation lines, main irrigation lines. So we felt that at that time it might not be the best location. So we looked at the option of repurposing the tennis courts. We did the engagement, as Mr. Richter indicated. We had an opportunity to potentially save some money by repurposing them. So that's really why we are coming forward with this, to give, like Mr. Richter said, an update on the engagement. We have a little bit more information now that we've done more research that will feed the decision, but we're really just looking for some direction as to the option that we want to go. But like Mr. Fox said, there is no additional request for funding. All of the options fall within the approved amount.
Excellent. Thank you, Mr. Harper. I always like the opportunity to save money being brought to my attention. I appreciate that. I also do recognize that I think there was a lot of hopes and wishes and scrambling during the CIP, and this was an option that I guess council sort of said, let's do this. So I appreciate that extra work has been done to identify some challenges or opportunities. So thank you. Thank you, Mr. Chair.
Councillor Middleton Hope.
Thank you, Mr. Chair.
I see your name there this time.
Quite loud. I guess this question is to Mr. Harper, although anyone who knows the answer could probably help me out. I get a sense from the report that's provided that we're centralizing many of these courts as opposed to providing opportunities for people to go to courts closer to their homes. Would that be a fair assessment? And if that's the reason, or if that is the outcome, can you explain the reason why?
Sure, I'll let Mr. Whitkey with the pickleball respond first, and then I can offer some information as well.
Thank you for the question, Mr. Middleton Hope. The reason that we wanted to centralize the court facilities in Legacy is because if Lethbridge is ever going to hold any type of tournaments, be it provincial or nationals, we need to have the courts consolidated in one single area. And so that was determined to be the best area because very little has to be moved. Both courts are adjacent to each other, plus the pickleball court then would be able to possibly add a gazebo type effect so that if we are running tournaments, we had some shelter, and a lot of those proposals were done in conjunction with the City of Lethbridge and the management. So when we did that, we thought that was the best scenario that we could have for both the pickleball players, for the community, and for the outreach that pickleball will have in the community.
Okay, so that doesn't preclude other areas of the city in applying for funding and or requesting the development of pickleball courts or the repurposing of tennis courts into pickleball courts. That's a lot, pickleball courts.
We would love that to happen. Our pickleball group is growing exponentially. Just to give you an example, there's an offshoot of Riverstone. It's called Riverstone Pickleball Club. Right now they have over 300 members. It's held at the Emmanuel Lutheran Church on the west side. And they are running beginner clinics where there's 12 to 24 people learning pickleball all the time. It is a sport that can be played by all ages, all age groups, families, and it's become probably one of the most popular sports that, if you look at the activity of the sport in North America, it's probably exponentially one of the fastest growing sports in North America, and also going on into Europe and places like that.
It ain't so. Okay, just in regards to tennis courts that could be repurposed, that are perhaps on private land as opposed to public lands owned by the city, is there an opportunity there for groups, communities that have existing tennis courts that want to repurpose them? Are there funds that they can access to have that done?
I can respond to that, and then just add a little bit more to what Mr. Witzke said. There are other courts at various areas of the city that we have actually painted pickleball lines on to allow play in other areas of the city. And we also are going through a process when we're looking at the new school sites to incorporate pickleball courts in different areas of the city. So we are adding courts as we go. As far as repurposing private tennis courts for use with pickleball, there would be some. There is a grant with the city available. It's called the Community Capital Project Grant, but there are some restrictions of who can apply for that and what type of organizations. Individuals would not be able to apply, but for example, nonprofits, if there's a neighborhood association, would be able to apply for funding for those types of things.
Okay, thank you.
Councillor Palladino.
Thank you, Mr. Chairman, and thank you, gentlemen. I'm not sure, I think I heard part of the answer to my question, but as an aging tennis player, I can see myself playing pickleball sooner than later, but I wonder if there's an opportunity to use some of the playing surfaces for both users, and I think I heard the answer. And can you double paint on these and share it between the two, tennis and pickleball?
Yes, we can, Councillor Palladino. As an example of that, just a little ways away from here at the Kinsman Park, there is a set of, I think there's 2 tennis courts there where we actually did double paint, and we did have some set times where pickleball could make use of that facility, and then the rest of the time obviously was for tennis. So there has been opportunities and instances where we've done that and users have shared.
Oh, go ahead.
One of the things that that you need to though really consider is the wind in Lethbridge. If we get over 20 wind, you have to remember we're playing with a wiffle ball, not a tennis ball, so it is very light. So the reason that the 12 courts that we're going to establish or have in Legacy, they will all be windscreen protected. That's a critical issue that we have to have with our court facilities. So yes, we can play on tennis courts, but if the wind is over 20 it basically the ball will move all over the place. So I mean, sometimes we can put up temporary windscreens and things like that. But the reason that we're consolidating, as we talked about before, is that it's because of the windscreens that are going to be highly critical in the performance aspect of these courts.
I guess an indoor court would be the answer then.
Well, we hope to be coming to the city with building indoor courts. Right now, the only indoor courts that we're using is the Civic Center, you know, the Lethbridge Senior Organization. So when and if the city ever does build a complex, we'll come knocking on your door.
Well, I was thinking out in the rotunda here. That's got enough headroom in there.
Councillor, I'm sorry, are you done? Yep. Are you done? Yep. Councillor Carlson.
Thank you, Mr. Chair. I think some of the questions and discussion have helped me a lot here. So let me see if I understand. We've got a couple options in front of us to recommend to council for either changing or just going forward with the CIP. Option 1 is to repurpose the existing tennis courts, and that would save about $400,000. Is that correct?
That is correct.
And it would achieve exactly what council through the CIP process wanted?
Not exactly. It would be at the expense of 2 existing tennis courts.
Agreed. But for pickleball, it would achieve the end goal that council directed in D30, correct?
Yep.
Excellent. Further to that, what I'm hearing is you can play a tennis on a pickleball court or pickleball on a tennis court. So when no one was playing pickleball, if it got up to 22 kilometers, which is any day ending in Y in Lethbridge, those same courts could still be used for tennis. Is that correct?
Councillor Carlson, if the court is dedicated to pickleball, they have posts that are installed for the pickleball court size, which are a lot different than tennis. So if it's a dedicated pickleball court, you would not be able to play tennis on it. However, you can paint lines, pickleball lines on a tennis court and play pickleball on a tennis court.
Okay.
I can try and help explain that, is that on half of a tennis court, you can set 1 pickleball court up. So therefore, the posts are then in the dividing line, so nobody runs into the posts. Where if you were to set up 2 pickleball courts, the posts would be in the playing area. So when you go for some balls, you could hit the posts.
Okay, I think I'm getting it now. So it's not as exciting a solution as I thought. Would this eliminate all the tennis courts at Legacy?
Councillor Carlson, that's correct.
Okay. And to construct new tennis courts is going to cost the $364,000, I think that's in our package, still within budget. But I've heard that some of the challenges were landscaping or irrigation, can't recall. Those would probably still remain then in trying to locate 2 new tennis courts, correct?
Just to confirm, I think you said construct new tennis courts or new pickleball courts, because
the construction of the new tennis courts is in our package at $364,000. So if we use repurpose the existing tennis courts and then constructed new tennis courts elsewhere, we'd still have the same issues coming to us about irrigation, landscaping, siting, correct?
Well, the thing is, we'd probably we'd either develop or construct the new tennis courts in Legacy where there is irrigation, so yes, it would be the same issues, or if we were to find a different location in the city, there may or may not be infrastructure issues.
Okay. Thank you, Mr. Chair.
Councillor Palladino, are you still in the queue? Okay. Option number 2, if I may. It says keep the tennis courts at Legacy Park as a pro, but then as a con, it says tennis users might be upset about tennis court relocation. So are you saying that you're going to move where the current courts are to another location?
So if option 2 was chosen, then we would look at either building new tennis courts in a different location in Legacy or a different location in the city.
But Legacy is still on the table.
Yes, correct.
But it would be relatively close to where the pickleball courts would be. What would be the plan? Let's just say option 2. Let's do it. What are we gonna do?
Yeah. So if you look at in the attachments, location 2, there's a proposed location in essentially a vacant field at the moment where those new tennis courts could potentially go. So if you see location number 2, PDF, there's a box selected that shows potential location for the new tennis courts, which you can see there is existing irrigation in that field. So there would be some work to fix that irrigation.
But again, within the budget of the CIP.
Correct.
And you would also, why would tennis people be upset? Because it's just a small change of location, right? It's not horrible, like you're not moving from the north side to the west side of the city.
That's correct, yep.
Okay. Any other questions? Councillor Schmidt-Rempel.
So just to follow up on that then, when we look at location 2, it's the field that would disrupt landscaping irrigation. And when we look at location 1, it doesn't disrupt as much, but we need to lose the 2 tennis courts on that one?
That's correct. I do want to bring to everyone's attention option 3. That was the original plan in the CIP. And the big thing we wanted to make sure was there's a main irrigation line running in that new location, proposed new location. We have confirmed that we can eliminate that piece of pipe and it won't cause any concerns for the irrigation system itself. And that site, the site north, which was initially planned in the CIP, we weren't actually sure it would fit in that location. We've done some further work. We've determined that it will fit. It'll look a bit funny, but it will fit and it will work. And with the existing irrigation there, we can replace that line and the new courts will work in that proposed location.
And is that still at it's option 3? That's 523.
Yep, that's correct.
Oh, option 2 is more expensive. I thought. Yeah. Okay. Okay.
So if I could just add in there. So I guess in summary, when we first started talking about the problems with that north area and the opportunity to repurpose tennis, there was an opportunity to save some funding. So that's really where we started to talk about bringing this forward to get some direction from SPC and council on which direction to take. And then since that time, like Mr. Richter said, we've gotten additional information that says, okay, we can build it to the north, not an issue. So that option 3 has been added back on here, but we just needed some direction of whether we're going to look at saving money and repurposing tennis courts, or whether we look at a different option.
Well, in my mind, this is a win-win for everybody. Pickleball with tennis, we keep things pretty much as they are, and include more pickleball. That's a new one. That's a new game we're gonna. We'll stick with pickleball for now. Okay, Councillor Carlson, you have a question.
Thank you, Chair Campbell. Just because I really like saving money, I just want to check, is there any way to build something or to repurpose something so that both pickleball and tennis users can use the same courts? Or is it impossible?
I don't know. I don't know all that's involved in the construction of pickleball courts. I know what is out there in the existing courts. The pickleball posts and the fencing or the netting is fixed, so the posts are inserted into the asphalt in the ground, so they are fixed. So unless you went to a type of system where you were able to remove posts to open up the space for tennis, I don't think it would be possible to have both. Now, you run into all kinds of operational problems, and like was stated, if there's a little bit of a breeze, then you run into potential that the posts get blown over. You have to store posts and netting. You have to move them in and out. You have to change tennis back to pickleball whenever it's needed. So there are some difficulties there.
Okay, thank you. Nobody has come forward from some technology company smarter than I have. Push a button and the posts come out of the ground. I wish. Anyways, thank you. Thank you, Mr. Chair.
Any other questions? I personally would like to recommend option number 3 moving forward. Does anybody want to add to that? Yep, Councillor Palladino.
And leave leave the existing tennis courts alone? Is that what that means?
Would be left as is, yeah. We still have the 12 pickleball courts, and the problem with landscaping is no longer an issue. It's not being disrupted, right? That is correct. So that was one of the issues, but it's not. Right. Councillor Schmidt-Rempel?
Yeah, I'm tending to lean that way as well. We keep the best of both worlds, move forward what was in the current CIP. While I'm like Councillor Carlson and I enjoy saving money as well, on this one, I think that we had enough and we've seen enough engagement that we do need to keep both in our community.
Councillor Carlson.
Thank you, Mr. Chair. Just how firm are we on these numbers? I've seen that even at the 523 mark, 523,000, we're still under budget from the CIP. So are these numbers all in? Knowing that some surprises can come up with tenders or construction, but does this include the relocation of the irrigation line, et cetera, et cetera?
Yeah, Councillor Carlson, I can add to that. The numbers are fairly accurate. We had the estimate done just over the last 6 weeks. The only piece that's missing is we'd actually have to go and get a design done. So a detailed design, which is usually about 10% of a construction project. So if we choose option 3, we're still likely going to be within budget. The only concern is that, as we've all been aware with supply chain issues and costs have gone up incrementally for everything these days, that's a risk that we have to deal with.
Agreed. So it will just go to tender and we'll see how it comes back in if council agrees. I think if you can make sure that there are no 2x4s or 2x6s used in the construction of this, the price of those has gone through the roof lately. Anyways, thank you, Mr. Chair.
Thank you. Any other questions? Okay, I guess as the resolution will read, are we good with saying option 3? Okay. So this is a resolution from Deputy Mayor Schmidt-Rempel. Be it resolved that the Cultural and Social Standing Policy Committee recommends that Council receive this information and direct administration to proceed with option 3. Is that correct, Mr. Clerk?
Certainly, we're adding some extra words on the screen for you.
I'll allow it.
Can I ask a question?
Yes, go ahead.
Do we have to recommend option 3 to council? Council already approved option 3.
I believe if it is the SPC's wishes, we'll just carry on. I don't believe there needs to be a recommendation, and we can just continue on with the process of the CIP as directed before.
Okay.
If the SPC wanted a change, that's when we would have to go to council and inform them and carry on with the decision.
Oh, okay, good. Then we don't
Thanks,
have.
Councillor. The motion then would read to proceed with the construction of pickleball courts in accordance with CAP budget item D30. It would not read the option 3.
Okay, thank you.
That satisfy everyone here? Yes?
And that will be sent to council for their information because there are only 4 of us on the committee. If 5 members of council wanted to save some money, they could overturn this at council, correct?
Certainly, it'll form part of the consent agenda on the May 10th meeting.
Excellent, thank you.
Great. So now the resolution is?
Brown's just working on it. It should read, be it resolved, the Cultural and Social Standing Policy Committee recommends that council receive this as information and direct administration to proceed with the construction of pickleball courts. Sorry, I'm just flipping my screen, as outlined in the Capital Improvement Program budget item D30.
Okay.
Option 3 would be struck from the motion.
Okay. So do we need to read that again? Is outlined in? Okay, there we have, that's the completed resolution there before us. Okay. Oh, Councilor Palladino.
Goes to council, and they don't know what the SPC recommended, right?
It'll be in the consent agenda.
Right, but, I mean, what if they pull it out and council as a whole pulls it out and says, well, no, we want to go with repurposing the existing?
That can be done.
That can be done, certainly can, and Mr. Fox spoke to that a few moments ago as well, is council as a whole could amend this item.
Councilor Carlson, are you still in the queue?
No, I'm good. Thank you, Mr. Chair.
All right. So you see before you the resolution as is. We're just kind of going ahead with what was already in the CIP, D30. Councilor Schmidt-Rempel.
Council approved this, the 6 additional courts in the 2022-2031 CIP in June last year. The demand for pickleball has increased, and this allows us to increase those opportunities and meet those needs. I will call the vote.
Question's been called. In favor? Opposed? That goes. Passes, that is.
Mr. Chair, just a comment.
Yep.
To our administration, again, anytime you can find a way to let council consider saving money, keep bringing those forward. Thank you.
All right. Okay, let's move on to, where are we? 6.4. Oh, this is Community 6.4, Jillian Bracken, Community Arts and Culture Manager, Utility Box Wrapping Program Report from Administration.
Thank you, Mr. Chair. I believe the report is fairly, I believe this is my resolution to make the amendment or recommend the amendment to council.
Right.
I believe the report is fairly explanatory. We requested that the Allied Arts Council provide this report. I think it makes better sense for our administration to provide the report, but liaise with the Allied Arts Council and other partners to get all the relevant information. So I think that's the change we're recommending.
Okay. We also will require a majority vote from the SPC to go to council, and then a 2/3 vote on council for adoption. So just to read the resolution. From Councillor Carlson, be it resolved that the Cultural and Social Standing Policy Committee recommends City Council rescind the words "the Allied Arts Council" from its March 8th, 2022 resolution and replace it with "Administration, Recreation and Culture" as follows. Therefore, be it resolved that Council requests that Administration, Recreation and Culture provide a report to City Council regarding the completed pilot project together with any recommendations with respect to the feasibility and cost of wrapping additional utility boxes, with such report to be provided by November the 8th, 2022. And Councillor Carlson, if you want to wrap up.
Thank you, Mr. Chair. Just quickly, because I always want to ask, directing administration to complete this work, is there capacity?
Mr. Fox?
To get this done in-house?
Through the chair, yes, we can accomplish this in accordance with all our partnerships and talking with everybody. We can have a report back for that date.
Excellent, thank you. If there's nothing further, then Mr. Chair, I'll call for the vote.
Call for the vote. All in favor? Passed. Thank you. Okay. Right, okay, we're going to Mr. Fox, Director of Community Services, Outreach Support Services Initiative Funding Evaluation. This is to approve $80,000 as a one-time allocation from the MRSR to an RFP. We talked about this at our last SPC. Any questions from anyone? I see none. Just Mr. Fox, this is just to go ahead and to find the recommendation for a funding model for OSSI.
Through the chair, yes. What it is it's approving up to 80,000. Again, we have the scope of work as we're looking at. Because our OSSI is integrated with the rest of our funding, we will be looking at our full funding model that the city does to provide through community social development and providing the best option for Lethbridge back. And we'll be using a third-party consultant. So that is up to $80,000.
Councillor Carlson.
Thank you, Mr. Chair. I didn't see a recommendation or a draft resolution in our package. I was wondering if this was just for information.
Apologies, Councillor. It was sent to you probably moments ago. It is the exact same wording as the recommended action on the report.
Do you want me to read it out, Councillor Carlson?
Certainly, thank you.
Be it resolved that the Cultural and Social Standing Policy Committee recommends that Council adopt the following recommendation. Approve up to $80,000 as a one-time allocation from the MRSR to proceed with an RFP to evaluate the OSSI funding model currently administered and monitored through the City of Lethbridge.
Further question, if I can, Mr. Chair, through you to City Manager or Mr. Fox or designate. We just heard a report that our integrated funding strategy is working well. We're having better efficiencies. We're seeing greater impacts, greater outcomes. It's something that's been in place for a brief time. When I see about splintering the funding off again, it seems to be going back to the way we used to do things. And I see that if you pull out OSSI funding, well, then maybe after that you pull out Reaching Home dollars and create another group, and then you pull out FCSS dollars and create another group. I just honestly, right now, I'm seeing that things are working well. The integration of the funding with one group organizing it and overseeing it, and we heard, I think, in my questions that we still have to provide oversight for this, and all it would do is then complicate the procurement process. So I'm wondering, is staff recommending that we go back, or is this just a well, let's kick the can a couple more times, even though we've just recently decided to integrate? Now it seems like we're saying, well, maybe let's kick the can around and see if we unintegrate. Is that the way things seem to be? Is that what this resolution is saying?
So I'll start. This is really looking at grant management best practices, best return on investment, and options to see if there's any opportunities for improvement. So you've touched on what we're doing is working well. What it's really about is there opportunities to even improve on that, whether it's better or slightly different ways. So different is still a possible option, but again, somewhat continuous improvement is there further efficiencies that we could obtain. So with that, if Mr. Fox has anything else to add to that.
Thank you. Yes, the reason why this is coming forward was from a previous direction from council. So administration is always open to looking to improve our systems, especially when there is differences of opinion. So again, the integrated system is working very well. And it wouldn't be necessarily splintering the way that we're doing it currently, as we would still have to oversee the money in the same manner as we are now. So we would still need our advisory group or the CWSC, if that is approved, to make recommendations, and all of that would still have to happen, and we would have to be doing the same reporting back to the province and federal government. Again, there is different ways that different communities operate with the OSSI funding. So this would be going out and making sure that we are doing the most effective, as Mr. Beverly, sorry, Lloyd, as you just stated there. So,
what's his name?
Mr. Beverly.
Yeah,
close enough. Excellent. So, okay, thank you.
Councillor Schmidt-Rempel.
And certainly, I'll take the heat for this one, because it was my idea that came forward a month or so back, that I recommended we take a look at this, just considering that we did see from our different community operators, we did see and hear about some gaps that were going on throughout the COVID crisis. And I brought this forward just to discuss that maybe we do need to look at OSSI funding, but I do appreciate that Mr. Fox is taking an opportunity to take a look at the full funding model to make sure that we are offering our disenfranchised residents the best possible services that this city can be offering. So I do appreciate that.
Councillor Carlson, are you still in the queue?
No, I'm good. Thank you, Mr. Chair.
Any other questions? I see none. I think I read the resolution. This is from Councillor Schmidt-Rempel. Anything else you'd like to add?
No, and if nobody has any other questions, I'll call the vote.
Question's been called.
I have some debate.
Oh, sorry.
sorry.
Yeah, certainly. Councillor Carlson, go ahead.
Thank you, Mr. Chair. I won't be supporting the motion. I appreciate that that new eyes want to look at things new ways. I completely get that. We have just recently implemented the integrated funding strategy as we heard earlier today. It's working well. I'm going to admit that I was a bit of a hard sell when we went to the integrated funding strategy because the old process where we did sort of splinter the funding out to see who doled it out. I had spent a decade and a half in that process. I understood it well and I thought it worked okay. I think I've seen the benefits to the integrated funding strategy. It's only been in existence for a very brief time. It's just getting their legs under them. And I think before we say, well, maybe we were right before, so let's hire a consultant at $80,000 to tell us if we made a mistake in integrating. I don't think I'm ready for that. I'd like to give the CWSC some time. We've seen good results so far. I'm thinking we're hopefully going to see continued efficiencies, some greater impacts, greater outcomes for this under the system that was proposed and is still fledgling. And I don't see the benefit of spending $80,000 to say, were we right? When I think we've got some facts backing us up that this was a good way to do it. And as I said, I was a hard sell. So I'm not in favor of spending the dollars to revisit something that's very new. So I won't be in support, but thank you.
Thank you, Councillor Carlson. I will be supporting this. Just another way to make sure we are doing things right. This is just another tool that we can use to make sure that what we're doing is the correct way to go about allocating these very important monies to the right people. Any other debate? Okay. No other debate. Then we'll do a roll call vote. Councillor Middleton Hope, or Councillor Schmidt-Rempel.
In favor.
Councillor Carlson.
Opposed.
Councillor Palladino.
In favor.
Campbell, in favor. That passes. Thank you. Moving on to Kara Motz, CSD Operation Manager, Re-Community Wellbeing and Safety Strategy Funding Amendment. This is, as I understand it, we're approving $120,000 to the Canadian Mental Health Association for subsidized counseling services. It's all in your package there. I guess if I can just ask Ms. Motz, was this something that just unexpectedly happened to need the extra for what you're using this for?
So subsidized counseling services are currently available through the Integrated Coordinated Access System, which is held by the Canadian Mental Health Association. So the service uptake, the increase that we've seen in the last 4 months was unexpected, and so we are requesting additional funds for subsidized counseling in the community.
Does this, taking this money, going to this, does it take money away from anything else?
No.
Okay. Any other questions from anyone? Councillor Carlson.
Thank you for that. So this was, these were dollars kept in contingency, I'm assuming out of FCSS that traditionally funds the subsidized counseling services?
This is surplus and previously unallocated funding from both FCSS and the Reaching Home funding portfolio.
Excellent. What is left in surplus or unallocated?
Every funding source is a little bit different. FCSS, we are not able to have any carryover beyond 2022. So if this allocation is approved, we will have all FCSS funding allocated. And with Reaching Home, we are actually waiting for some new agreements from the Government of Canada right now. So we still have some unallocated Reaching Home funding that we are expecting once we get our new agreement.
Okay, thank you for that. Appreciate that. And is that something new that we're not allowed carryover? We used to. I know that they don't like us to have a carryover, but we used to always be able to write to the FCSS manager and request a bit of a carryover. Have they now said absolutely no way, no how?
Carryover is typically allowed with FCSS funding, but we are coming to the end of our agreement term with the Government of Alberta at the end of 2022, and we've been given instruction from the Government of Alberta that we are not to have carryover at the end of 2022.
Excellent. Thank you for that. Final question, if I can. This is an agreement with CMHA.
That's correct.
Now, do they provide the counseling services or do they subcontract?
They do not provide the counseling services. The counseling services are at the decision of the client. The funding follows the client and not a service provider. So CMHA is the agreement holder for Integrated Coordinated Access System, and these funds fall within that ICA work.
Excellent. Thank you, Ms. Motz. I appreciate that because I know from past work with these organizations that clients do like to have choice. So I appreciate hearing that that's still an option. So thank you. Thank you, Mr. Chair.
Any other questions? I see none. I have a resolution from Deputy Mayor Schmidt-Rempel. Be it resolved that the Cultural and Social Standing Policy Committee recommends that Council adopt the following recommendations of the Community Wellbeing and Safety Council Safety Strategy CWSS Advisory Committee with funding leverage from the Family and Community Support Services FCSS and Reaching Home RH funding portfolio. 1, approve $120,000 to be allocated to the Canadian Mental Health Association for subsidized counseling services. And further, that city administration be authorized to prepare the applicable final fee for service funding amending agreement for the mayor and city clerk to sign, which shall be subject to annual review and renewal at the discretion of the City of Lethbridge, pending available funding from the Government of Alberta and Government of Canada. Deputy Mayor Schmidt-Rempel.
If my colleagues have nothing to add, I'll call the vote.
Anything to add? I see nothing. Vote's been called. All in favor? Passed. 6.7, this comes from Ross Kilgore, Community Planner. Read the request for decision to initiate the process of designating the Oliver Block as a municipal historic resource. Is Mr. Kilgore? Mr. Kilgore is online, I see. Okay, great. Any questions for Mr. Kilgore? I see this is a pretty straightforward request. Very significant part of the downtown is the Oliver Block, looking for a municipal historic resource. Is that correct, Mr. Kilgore?
That's correct, Councillor. The owner has applied for municipal historic resource designation, and Historic Places Advisory Committee have worked with them on a statement of significance that they're comfortable with a list of character defining elements. And so now it's proceeding to SPC to make the decision on whether or not to recommend that the council proceed with designation.
Right. Any other questions for Mr. Kilgore? I see none. I have a resolution from myself. Be it resolved that the Cultural and Social Standing Policy Committee recommend that City Council direct the letter from the Historic Places Advisory Committee be received as information. 2, the city clerk send a notice of intent to designate to the property owner of 316 5th Street South. And 3, a designation bylaw be prepared for consideration by City Council after the requested 60 days notice has passed. Any questions or debate? I see none. Call for the vote. All in favor? That passes. And that is the end. We will stop. What's the word I'm looking for? Adjourn. Thank you. When I used to have a turntable, why, we'd have...
Sorry I couldn't be there in person. See you all soon.
All right, see you.